at 1 on MSNBC.
Find a way to divide and conquer the people who are on assistance.
Repealing Obamacare is the first step.
All eyes are on this race.
Any path to a GOP takeover of the Senate is likely to go through North Carolina.
Find a way to divide and conquer the people who are on assistance.
Winning that Senate race is key to moving forward.
Obamacare is probably the single greatest threat.
He has said no to Medicaid expansion.
I think we have to repeal Obamacare.
500,000 people in our state would be covered.
We're trending in a direction where we should consider potential expansion of Medicaid.
Potential expansion of Medicaid.
I would encourage the state legislature and the governor to consider it.
This time last year, Republicans were jumping for joy at the alleged failure that was Obamacare. You know, the rocky rollout of the healthcare.gov provided plenty of ammunition for the conservatives, for the GOP especially. 1 year later, tables have turned quite a bit, haven't they? Website problems are fixed, and according to the New England Journal of Medicine, over 10 million people got health care coverage during Obamacare's first open enrollment period, and it's becoming a hot issue in the midterms. 27 states have expanded Medicaid, providing care for millions of low-income Americans. This move will save hospitals over $3 billion this year. Now, less than 2 weeks from the midterm elections, some Republicans are starting to embrace Obamacare, and they don't even know it. Down in North Carolina, State Speaker Tom Tillis is trailing Senator Kay Hagan by just 3 points in a close Senate race. So down the stretch, it's close. What do? Last night, Tillis reversed course on Obamacare and made these shocking comments.
And I think we're trending in a direction where we should consider potential expansion of Medicaid if it means that our overall cost for providing health care is lowered, because it'll take some pressure off of hospitals and providers, and they do need help. But you need to do it in a way where when you're adding a dollar, you don't have 15 or 20 cents of it going to waste and inefficiency.
Tom Tillis, he's for government programs. Looks like someone is trying to steal a few votes from Senator Kay Hagan. Tillis has done a complete 180 from his previous stance on Medicaid expansion. He was running this radio ad earlier this year.
Tom Tillis has a proven record fighting against Obamacare.
Tillis stopped Obamacare's Medicaid expansion cold. It's not happening in North Carolina, and it's because of Tom Tillis.
Well, somebody better erase the tape. Talk about a change of heart. I'm joined tonight by Bob Shrum, Democratic strategist and professor of politics at USC, and Reverend Dr. William Barber, president of the North Carolina NAACP. I got to ask you first, Reverend. Thanks for joining us tonight, gentlemen. Reverend, what do you make of this reversal of Tom Tillis? He's down by 3. Now he's saying he wants to expand Medicaid. Do you believe him?
No, it's not a reversal at all. In fact, on that same show, he said that he wanted to repeal Obamacare. So he's saying one thing on one side of his mouth and something else out of the other. The fact of the matter is, he's been against Medicaid expansion. The bill they wrote was so regressive and extreme that the governor couldn't even move on it if he so decided. We're talking about, in that state, 500,000 people, 2,800 people will die this year. 40,000 women will not get the screenings that they should get. 27,000 diabetics won't get the treatment that they should get. We have 23,000 veterans in North Carolina that would have been eligible for Medicaid expansion. The majority of them are working poor. This speaker has been really against expansion and continues on the trail to say how much he's against the Affordable Care. He calls it Obamacare, which means he's also against people being able to get insurance despite pre-existing conditions, like my daughter who was born with the brain disease. This is political rhetoric. It's not the reality of policy.
Reverend, some of the folks around you are holding up a sheet of paper with pictures on it. What's that story about? I'm curious.
Well, this is our NAACP voter guide. You know, we don't tell people who to vote for because we're nonpartisan, but we do tell them how they voted. And so since we're electing every member of the General Assembly, every member of Congress, and 2 people for Senate, we've done a voter guide that actually shows where they were on the issues, who they are endorsed by, what they have stood for, because people need to know where people have stood so that they can decide who is with them.
What a great effort. Bob Shrum.
We're on a tour all across the state.
I know that. You put on a lot of miles and done a lot of work with those Moral Mondays as well. Bob Shrum, what do you make of this? We had a story here last night where we saw the governor, John Kasich, do a quick clarification to the media about where he stands on Obamacare. The numbers are what they are. They have to find a way to talk about this, don't they?
Yeah, look, Kasich committed truth, which is a mortal sin if you want to think about the Republican primaries in 2016. So he tried to backtrack, but he and Tillis both don't have any place to go. You can't keep the Medicaid expansion without having the provisions in Obamacare that A, help to finance it, and B, help to reduce costs so that it's affordable. Beyond that, by the way, it's a wonderfully Republican idea if you think about it. If you listen to Tillis carefully, he said we could consider expanding Medicaid. He didn't say he was for it. So what they're really saying, in effect, is we'd consider covering the poor. Maybe, we might not, we might. But we'd leave out the working families, we'd leave out the middle class, because we want to get rid of the rest of Obamacare. It's unbelievable.
Reverend, how can health care not be a mover when you actually have politicians in North Carolina who want nothing to do with Obamacare, but it has affected the lives of so many people? The Medicaid expansion brings health care to low-income folks in this country who were going to the emergency room to see doctors, which was raising costs for all Americans and raising insurance premiums. We've seen a change in all of that, the rate of growth. So how can this should be an easy sell to folks in North Carolina, shouldn't it?
Well, you know, Teddy Roosevelt, a Republican, actually pushed for health care expansion to all Americans. Listen, in North Carolina, hospitals are closing because of the denial of Medicaid expansion. Working poor people are being denied health care expansion. We're losing billions of dollars over the next few years because of refuse. In fact, $4.9 million a day. And now almost 60% of North Carolinians are saying that we should expand Medicaid. That's why the General Assembly and the House, particularly that Tillis oversaw, is down to 19% in the polls, because people know that what they're doing is regressive, it's wrong. This should not be an issue of partisanism. It should not even be an issue of election. It should be electing to do the right thing so that people's lives are saved, jobs are saved, hospitals are saved, and people have a better life.
Will there be a good turnout, Reverend?
There's going to be a powerful turnout. Let me tell you, I've been on this tour. Tomorrow in over 50 counties, people are marching to the polls, literally on the first day of early voting. We have been starting today. I'll be on for 2 weeks. We've been in 3 counties in the western part of the state where you normally wouldn't expect the NAACP and others to have traction. And we've had people turn out like these good people who are gearing up, who are raring to go. We're going to contact all 286,000 African Americans who voted in 2008, 2012, didn't vote in 2010. This is going to be our own election because it's about real issues, life and death.
Now, Bob Shrum, let's talk political history. History tells us it's going to be low voter turnout. Is there a real possibility that this could be one for the archives because the issues are so tight?
I certainly hope so, because the truth of the matter is that if African Americans don't turn out, young people don't turn out, even though this Republican Congress, for example, has a dead approval rating, people can't stand them, they're probably going to capture the Senate. So we need this turnout. What the Reverend's doing, what other people are doing around the country is important. I also think voters may be pretty smart, because this game on Obamacare isn't just happening in North Carolina. It's happening all over. You know, you got Mitch McConnell saying, oh, we'll keep Kynet, which is the Obamacare portal in Kentucky. Well, the fact is there won't be anything on that website if you repeal Obamacare. It's like Anatole Francis' description of a munificent bequest in a will. And you have this Ted Cruz clone up in New Hampshire, Marilinda Garcia, who's running for Congress, who says, oh, I want to keep the ban on pre-existing conditions, that you can't be denied coverage, but I want to repeal Obamacare. That would bankrupt all our insurance companies, because people would wait till they got sick, and at that point they would buy insurance coverage.
Will that motivate people to get out and do what they've got to do?
I hope it does, because it's in their interest.
Okay. Bob Shrum, great to have you with us. Reverend Barber, thank you for your time tonight and your great work. I appreciate it so much. Coming up, Rick Scott's unsavory earnings.